Hello, everyone. Welcome to PCE Final Frontier podcast. I am Shivangi, your PCE guide at PCE Final Frontier, helping one student at a time. Visit our website www.pceff.com to enroll in our courses today. Hello, everyone. Welcome to PCE Final Frontier CAPR content podcast. Today, we are going to talk about supervised clinical practice hours. Now, supervised clinical practice hours applies to all internationally educated physiotherapists that are applying to CAPR's credentialing process. CAPR requires minimum supervised clinical practice hours to ensure that your practical skills represent the skills of a university trained graduate present in the Canadian healthcare system. Now, what are supervised clinical hours? Supervised clinical practice consists of supervised and an evaluated experience as a physiotherapist in training, where as a student you gain practical experience and engage in range of treatments, professional opportunities in different settings for the purpose of improving and applying your PT knowledge and skills. It does not include your academic classroom hours or when you practice on other students. That is not counted. Now, do you know how many hours are needed? A minimum of how many hours of supervised clinical education is needed in total? Take a guess. Well, let me tell you. An applicant's entry to practice or university level physiotherapy degree must have a minimum of 1025 hours of supervised clinical education in total, with a minimum of 100 hours musculoskeletal, 100 hours neurological, and 40 hours in cardiopulmonary conditions. The applicant or student must have successfully completed these minimum numbers of hours that they have mentioned. Now, what do you do if you do not meet these required hours of supervised clinical practice? Again, we all come from a diverse background, from different international countries. We all had different years of experience, different years of training, different years of schooling. So, how do you address the gaps? What do you do if you do not meet this? If your transcripts do not meet their numbers, what do you do? Well, CAPR lets you address these gaps by having hours that they recognize as prior learning. Now, what is prior learning? So, this is what they recognize as prior learning: a CAPR approved bridging program, or hours worked as a physiotherapist in a jurisdiction outside of Canada. Additional information about an applicant's education and work experience can be considered where an applicant has successfully completed a minimum of 700 hours of supervised clinical education in total and a minimum of 80 hours in musculoskeletal, 80 hours in neurological, and 40 hours in cardiopulmonary conditions. So you need to make sure that you provide all these documents that justify the minimum requirements of a supervised clinical practice hours to the CAPR. More information can be found on the CAPR or Alliance PD website. Reach out to us for any questions. Have a wonderful day. That's all for today. I will see you next time. Keep listening, keep learning. Thank you for joining today. Reach out to us at support@pceff.com for any questions. Follow us on social media on Facebook, Instagram, and YouTube for more content. Have a wonderful week and keep learning.